Certainly feels like Michigan is rapidly moving past the pandemic, but health experts are quick to say not so fast. There is growing concern about this Delta variant and the newly identified Delta Plus variant. Dr. Frank McGeorge here with more on what we're learning about this new threat. Doc?
Yeah, Devin, we've seen again and again in the past year how quickly things can change with COVID-19. The Delta variant has the potential to cause major setbacks. And with so many Michiganders still unvaccinated and all of the children under age 12 still at risk, it's important that everyone understands this isn't over yet.
The Delta variant is spreading, the more contagious and severe strain now detected in 49 states and accounting for 20% of all new infections.
This is the most transmissible of all the variants that we've seen, and we saw what happened in the UK where it overtook the entire nation, so I'm worried that's going to happen in the US.
The latest research suggests 2 doses of Pfizer and Moderna's vaccine are about 88% effective against the variant. Johnson & Johnson's estimated to be around 60% effective, but will likely still offer good protection against serious illness.
If you've been vaccinated with J&J, you should still feel very confident that if you get infected, you're not going to get particularly sick or die.
Still, infectious disease experts are considering the potential benefits of giving a Pfizer or Moderna booster dose to those who received J&J. No decision has been made yet.
There is more and more data coming in that mixing and matching may actually end up being pretty useful.
The Delta variant itself is still changing. India has identified 40 cases of Delta Plus, a version of the variant with another mutation. Experts believe that mutation could make it still more contagious, able to hold more tightly to receptors in the lungs and potentially less responsive to monoclonal antibodies.
Now, the vast majority of COVID deaths in the U.S. right now are in unvaccinated people. That means most of these deaths were likely preventable. The best way to reduce the risk for everyone and to stop the spread of the variants is, frankly, just to get vaccinated.
Still figuring our way forward for children, Doc. So is there any sign that the Delta variant is a bigger risk to them?
Well, Devin, there's no evidence that kids are more susceptible to it, but because it is more transmissible, they are more likely to be infected if they're exposed. Yeah. This virus basically just looks for the opportunity to spread, and children too young to be vaccinated are among those that's still at risk.
Yeah. A part of why it's so important for everybody else to be vaccinated so that we're not infecting children. Yeah, all right, Doc.
Right.